Our next speaker, Brigadier Fida Hussain Tara Imtiaz Military, and I am sure his topic is very intriguing. It will be about, I guess, around innovations in medical education. His title is Nuclear Medicine Education, Integrating the Emerging Concepts. Brigadier Fida Hussain.
Thank you very much. Thank you, Dr. Shazia, President, Pakistan Society of Nuclear Medicine, all the council for inviting me to deliver this talk. I have not selected this talk. It was assigned to me based on, because I am the Dean of the Faculty of CPSP. And recently we did a milestone. We completed our curriculum of FCPS, and I think it's last week it was published. That was a big task, and I am really thankful to all honorable faculty members. So the topic already displayed there. So how this sequence, how I will present this talk, that's the introduction and aim, and what is the new thing, what is the evolution in nuclear medicine, what are the new concepts, and what is the integration of these concepts into the education, challenges in the adopting newer models, and what is the future vision. So the aim of this talk is to explore how new advances in technology could be integrated in nuclear medicine education during residency and master program. The nuclear medicine education, I think this is the most difficult education in whole the medicine, because these patients from every specialty refer to our department for different types of scans, and even the most resistant cases of oncology, now they are referring to us for therapy. So theranostic is the new thing. So mainly radiology, molecular biology, oncology, cardiology, urology, and so many other specialties. The important thing that is the basics, that is nuclear physics, radiation protection, computer science, radiation biology. First time I launched, I landed in the PIAS. Previously it was called as Center for Nuclear Studies. Dr. Shazia is my class fellow. So first day, they taught us the mathematics. That was something which we never heard about, something integration and differentiation, then the nuclear physics, and then the radiation protection. So, and first time I touched the keyboard of the computer in the CNS, I was trembling. Something will be happen. There is something will be explosion. So that was the first time. Now the AI is taking over all the things. The first Nuclear Medicine Institute, I think maybe I am right or wrong, that it was established in Karachi in 1962. MSc Nuclear Medicine 2-year program started in PIAS in 1988 with over 150 to 200 graduates till date. FCPS in Nuclear Medicine, that is a 4-year program, started in 1997, and first graduate that was in 2002, and right now almost 50 graduates till date. In the pipeline, that is the 4-year MS program, I was discussing with the PIAS last week about this program. PhD, this is offered by the different universities right now. In the abroad, UK, that is the most difficult training program, I think so. But yesterday, the Dr. Gopinath, he said the most structured program there in India and Pakistan. So that was a good thing for us. And I think this is the most structured program. And in the new curriculum, we have different flaws of FCPS. So we try to remove that. Inshallah, in the next update, it will be more precise. What are the concepts in nuclear medicine? That is the theranostics, definitely, we heard about. That's advanced imaging modalities, radiopharmaceutical development, and artificial intelligence. Yesterday, Dr. Arif Sheikh was telling that there are more than 3,000 new radiopharmaceuticals in the market. And when we were doing MSc, there were few. We can recall all the half-lives and energies and everything. Just, I am wondering how the new trainees and these fellows, how they could remember the 3,000 radiopharmaceutical. So we need AI there. So then is the artificial intelligence. We were a big debate before this on this. I will just elaborate a few things about these topics. Theranostics, you know about this is the image, targeted therapy for individual and personalized therapy. Currently available, maybe I am wrong, that is neuroendocrine tumor, CA prostate, and CA thyroid. The curriculum should be updated to integrate topics of theranostics, especially those that are currently available in the Pakistan. In the imaging modalities, you know, PET-MR, Dr. Umar elaborate all things, but finally he said, no need to buy. That's a good thing. So PET-CT definitely it's the call of the day. So it should be as more as possible. And I could say, Pakistan Atomic Energy have 20 centers. I would like to say that at least 10 centers should have PET-CT. And there is artificial intelligence enhanced imaging, improvement in imaging acquisition and reconstruction to improve diagnostic efficacy. Definitely, when we install the complicated machine, we need the technician who can operate the machine. If we use this AI, we can operate easily with the little training. Radiopharmaceutical, definitely new markers, 3,000 in the market. In the next 5 years, maybe 6,000. So I know there will be many oncological areas where nuclear medicine people going to help all these patients, all these people who are not treated by the chemotherapy or radiotherapy. So we are the people, we can help them. And particularly our young nuclear medicine physician, they will definitely play an important role in this. But the important thing, we should taught them. If we were not telling them these things, they will not going to do that. They will just clear the exam and then they will do the routines just we were doing in the past. The important thing, what and how much we could produce here. So we can save a lot of money if we produce here. And Pinstick is doing a lot of good job, and they are trying to make as good as possible, not only the radiopharmaceutical, but also the theranostics agents for the treatment. The artificial intelligence is so important that 2024 Nobel Prize in Physics and Chemistry given to works associated with artificial intelligence. So prize in chemistry given to Demis Haspis and John Jumper on predicting protein complex structure, and to David Becker for using AI to make new proteins. We need new proteins. We need receptor-based treatment. We need new immunotherapies. So this AI will definitely help us to generate the new molecules. In the nuclear medicine, definitely AI in predicting and designing targeted radiomarkers, use of AI in workflow optimization, role of AI in quality control and image reconstruction. That's the important thing. There should be the ethical application of AI in medicine. And use of AI in automatic report generation. That is a question mark. How we can integrate? The number one thing is the curriculum adjustment, both in the master programs and in the fellowship programs. Another thing is creating mentorship program, use of experienced professional in guiding faculty members in emerging concepts. Use of technology in education, just like e-learning, AI-based simulation, on-hands training for theranostic by use of clinical rotations, hybrid imaging systems such as PET-CT and PET-MR, if they should be frequently available, so the fellows could easily spare time to spend on these complex machines. And AI-assisted imaging and international collaboration, that's important. So the conference like this conference, which open the doors for this international collaborations. What are the challenges? Number one is the lack of funding and infrastructure. That is important. Faculty development, regulatory hurdles, and fear of unknown. The issue regarding the lack of infrastructure, definitely higher initial cost. We need the buildings, we need the radiation protections, we need so much other things. We have to satisfy the regulatory bodies, what we are making. So it's very difficult for a single institute to do everything. So it's my opinion that different institute should be allocated, that this institute will treat these things and this institute will this. This will definitely help in the development and in the treatment. The solution is rotation of FCPS residents and MS students in setting where infrastructure is available, which right now we are doing. Encourage national and international grants and use of private sector partnership to secure latest equipment for students. And international rotational program. Regarding faculty development, definitely lack of exposure to the emerging technologies, because we people, when we join, we have the rectilinear scanners and the single head static gamma cameras. Now this is the PET-CT and PET-MR. So we are the people, we are unable to digest these new emerging technologies. So we are the people, we are running the faculties. So the solution is faculty exchange program, nationally and internationally. Institutional support and grant for research, partnership with international center and use of online workshop for virtual training in technology not available in province or country. Representation from all stakeholders in every faculty. Regulatory hurdles. The only problem with this regulatory hurdle, that is the nuclear. Radiation is used in the radiology, in the radiotherapy, that is in the medicine, and so many other areas in the industry the radiation is used. Are all these following the regulatory hurdles the world nuclear make difficult? Is it possible after 50 years, could we change nuclear something more palatable? So this is a question. If we can change it nuclear-like, radiology, everybody knows, every person, either is from the medicine or non-medicine, everybody, X-ray department. So X-ray department is known everybody. But what about the nuclear medicine? There's nothing like thyroid scan department. It's something different names. So it should be some common names, then the regulatory hurdle will be definitely decreased. So basically right now, there is development of institution-based pilot program that can act as a case study in adaptation and new teaching models. Continuous dialogue with regulatory bodies. We should tell them, so this is the technology coming and what they should do. So they should not increase the hurdles, they should decrease the hurdles. So they should help us, because we people, the future is the nuclear medicine. And we people going to help the patients which were not treated anywhere. So this is, we try to do this thing. There should be the doctors from the faculty, from the PSNM, that should act as an advisory role for regulatory bodies. So they should tell them that this is the problem and this is the possible solution. Fear of unknown, that is definitely, it is for me, it is a fear of unknown. If somebody says, okay, install a PET-CT, I will say, oh, this is something very difficult, I can't do that. So that's a fear of unknown. And the second thing is the AI. Because what we think that AI will replace our jobs, AI will replace us, that is a myth. I don't think so. All the aeroplane, they are flying on autopilot, but why the pilots are there? If the people sitting in the plane and they are told that there is no pilot, only autopilot will run, everybody will run out. He says, no, I will not going to sit here. So you need home manpower, trained manpower. So there should be the awareness program that we should adopt this AI. This is because this is helpful for us. It's not nothing that's going to uh, they're going to replace us. The future vision, that is the use of hybrid learning model, that is very important. Training institute collaborate in education of new generation of nuclear medical experts by use of virtual classrooms. So this is the era of internet. So we can take classes if the instructor is sitting in US or anywhere, so we can study. We should incorporate artificial intelligence in the education. There should be the residency exchange program, and I think nuclear medicine residency after other specialties. There should be the incorporation of nuclear medicine as a subject in medical school. That is very important. The people are not coming in the nuclear medicine field. And I would suggest that there should be the rotation of house officers in nuclear medicine departments. So they should think, they can see what we are doing. Conclusion with lengthy 3 slides. Integrating emerging concept into nuclear medicine education is vital for advanced healthcare. By embracing innovations such as AI, theranostic, and advanced imaging techniques, we can enhance diagnostic accuracy and treatment outcomes. Continuous adaptation in education ensures that professionals remain equipped to meet evolving patients' needs and improving overall care. A big question, a significant question arises. Nuclear medicine technology has evolved from retinal scanner to PET scanner within just in a half century. Yet our medical education system has evolved. This is a big question. The important thing, the encroachment of radiologist, radiation oncologist, medical oncologist, cardiologist, and yesterday somebody was telling about the immunotherapist into the nuclear medicine domain. If we will not educate ourselves, the future will be, what will be our future? Our future will be like this. Thank you very much.